My name is Nirav Shah, and I am the Director of Maine Center for Disease Control and Prevention. I'm joining you all today to provide an update on COVID-19 across the state of Maine for today, Tuesday, September 15th, 2020. Right now in the state of Maine, there are a total of 4,918 cases of COVID-19, an increase of 15 cases since yesterday. Of those, 4,415 are confirmed, an increase of 14, and 503 are probable, an increase of 1 case since yesterday. Of those new confirmed cases, half of today's new confirmed cases arise from York County alone. Overall, 10 people across the state of Maine are in the hospital with COVID-19, 5 of whom are in the intensive care unit, and none of whom is on a ventilator. Nationally, for context, the hospitalization rate for COVID-19 is 10 hospitalizations for every 100,000 individuals. That rate in Maine right now is less than 1 for every 100,000 individuals. Overall, 4,280 individuals have recovered, an increase of 43 recoveries since yesterday, and 137 individuals have passed away with COVID-19. And among our cases, 1,010 are healthcare workers. I'd like to turn next to some of the outbreaks that Maine CDC is most actively working on and engaged with. And let's start more generally with the events in and around and surrounding the August 7th wedding in Millinocket. Overall, there are now 176 cases of COVID-19 associated with that August 7th event. I want to take a second to turn to some developments that have occurred with one of the outbreaks most directly related to that event, which is the outbreak at the Maple Crest Nursing Facility. Overall, there are 39 cases of COVID-19 that have been associated with the Maple Crest facility in Somerset County. Just yesterday, Maine CDC became aware of an additional 11 cases at Maple Crest, leading to the total of 39 cases. These most recent 11 cases are in and among residents of the Maple Crest facility. But I want to stress that they are the result of periodic retesting that is occurring at the facility on a weekly basis. As I mentioned, in total, there are now 39 residents associated with that facility who have tested positive. And sadly, there have been 6 individuals associated with that facility who have passed away with COVID-19. One of those reports has just come into Maine CDC and is not reflected among the 137 deaths that I mentioned today. It will, however, be reflected in tomorrow's numbers. So to recap, at Maple Crest, there are a total of 39 cases and sadly 6 individuals who have passed away with COVID-19. More generally, related to the Millinocket wedding events, I mentioned there have been 176 cases, and including now the 6 individuals who have passed away at Maple Crest, a total of 7 individuals who have passed away with COVID-19 resulting from and related to the August 7th wedding in Millinocket. I'd like to turn next to some new outbreaks. Maine CDC just this morning opened up an outbreak investigation into the ND paper facility in Rumford in Oxford County, where there have been thus far 4 total cases of COVID-19. Given that this is a workplace setting, as we've talked about, one of the central questions will be whether the work site is the potential route of area of transmission or whether there may be other areas of transmission as well. We're working with the management at ND Paper to test all 600 employees of that facility, working with our colleagues at Rumford Hospital there to help us organize that testing and get those specimens to the Maine CDC laboratory. As we have more developments, especially around the results of that testing, we'll make sure to keep everyone updated. I'd also like to take a moment to mention a situation that is not yet an outbreak situation, but one that Maine CDC is working with, and that is at St. Dominic Academy in Lewiston. As of right now, we are aware of 2 cases associated with that school. It is not yet an outbreak situation. However, we opened up a regular line of communication with school officials, and we have made ourselves available to them to offer guidance and support as they are currently contending with 2 cases of COVID-19. And finally, I'd like to report on 3 outbreaks that Maine CDC has closed in the past day. One of them is at the Seal Rock facility, and then 2 are at 2 blueberry farms, one at the Merrill farm and the other at the Wyman's farm. I'm just going to really quickly mute one of the lines here that I understand is causing some feedback. So to recap, Maine CDC has just recently closed 3 outbreak situations. One was at Seal Rock, another at the Merrill farms, and the third at Wyman's farm. Now for an update on some testing metrics. First, based on, sorry everyone, just going to make sure that this is muted correctly. Okay, now for an update on some testing metrics. Based on approximately 2,708 tests received and reported to Maine CDC yesterday, the 1-day positivity rate across the state of Maine was 0.59% yesterday. That brings our 7-day positivity rate to 0.63%. For context, 2 weeks ago, that number was 0.60%. And the low point for our positivity rate has been 0.49%. So we've had a slight uptick in our overall positivity rate just over the past week. For national context, the positivity rate across the country right now remains at approximately 5%. Similarly, testing volume remains largely steady in Maine at 358 tests per every 100,000 people. Again, the national rate for that number is 226 per every 100,000, and the rate in Maine is 358. There's a lot of rich data that are being generated across the country right now with respect to testing. It can be difficult to get a sense of where things stand and what all the numbers mean. One of the questions that I get asked a lot is for resources around where to get a better sense of the landscape around testing. One of the sites that I have found to use a well-validated model, as well as a site that keeps its data up to date, is the New York Times' own coronavirus testing tracker website. I find it by Googling NYT COVID-19 testing, and it takes me right to that tracker. And again, they base their analysis off a well-validated model created by scientists at the Harvard School of Public Health. They also keep the data updated with the latest feeds from states and update their data at least once a day, if not more often than that. So if you're looking for a place to get some context around testing data, that is one site that I have found that does a good job of putting everything into context. Before we turn to some questions today, I wanted to take a moment to take stock in where the state of Maine is with respect to COVID-19 and assess where we might be going. Right now, across the state of Maine, things are of concern. During these media briefings, I have always endeavored to be straight to the point and not sugarcoat where things stand. And that approach means that today, I have an obligation to share my concerns with everybody. The bottom line is that I am concerned about where we are. Maine CDC is concerned about where we are. And thus, and really, everyone else ought to be concerned right now about where things stand with COVID-19 in Maine. As we go into the fall and into the winter, on the doorstep of flu season, The possibility of two concurrent epidemics, one of COVID-19, the other of influenza, arriving in the state of Maine with remarkable force is a possibility we cannot ignore. If we don't get a stronger grip on COVID-19 now, the arrival of flu season on top of that will make the fall and the winter that much more difficult. Today alone, York County accounted for 50% of the cases in Maine. And while there are outbreaks across that county, what we know as a statewide matter is that the virus is not isolated just to outbreak settings. It is spreading in the community in and around York County with remarkable force. What's also clear is that the virus favors gatherings. It does not distinguish between happy events like a wedding celebration or sad farewells like funerals. It is everywhere, but not just in York County. What we've seen just in the recent days are outbreaks in a paper mill in Oxford County, in a school in Androscoggin County, in a college in Cumberland County, and in a nursing home in Somerset County. Across the state, even in areas where there had previously not been cases, let alone outbreaks, we are now starting to see them. Now, even though today's number of new cases, 15, is low, in public health, we don't make policy or evaluate situations based on one day's worth of data. Statewide, as I mentioned, positivity rates have inched upwards just over the past week. And hospitalizations remain low. That is a good sign. Though just since the last time I've spoken with you, last Thursday, 4 more people have passed away. Again, case counts are increasing in counties that previously had few cases. And we have opened several outbreak investigations just in the past few days in counties across the state where there were previously very few outbreaks, providing further evidence that the virus is here. And by here, I mean everywhere. What I don't want to happen is that in communities, we wait until after an outbreak has been identified until we do things like wear masks or keep physical distance. We shouldn't wait for people that we know personally to be affected by COVID-19 before we ourselves do things to prevent our own families from getting sick. In my own mind, to me, that's a little bit like changing your diet after you've had a heart attack. Our approach to COVID-19 right now should not be to wait until there's a pin on the map over our town. Right now, that pin covers the entire state of Maine. Again, I am concerned about where we are. Maine CDC is concerned about where we are. And I'm asking everyone else to share in that concern. COVID-19 right now is not on the other side of the fence. It is in our yards. We have a window of opportunity in front of us before the arrival of flu season and before COVID-19 gets worse in Maine. Now, on the encouraging side, we have had windows of opportunity before in Maine. Indeed, even before the very first case of COVID-19 arrived in Maine, we had a window of opportunity and we seized it. We took advantage of that and took the preparatory steps that positioned Maine to be in a good place when COVID-19 arrived. We're facing a similar situation now. The gains that Maine has made against COVID-19 are ones that can and unfortunately could be washed away. However, we have an opportunity still in front of us to seize upon that and make sure that all of us are taking steps to put a lid on the COVID-19 situation in the state. Unfortunately, after influenza arrives, things will become that much more difficult. So I'm asking everyone today to seize that window of opportunity and do your part to help the state as a whole get control of where things stand and keep a lid on COVID-19. So with that, I'm going to turn things over to the media colleagues. And today's first question goes to Patrick Little.
Thank you very much, Dr. Shah. I have two things. Once again, going to ask you to repeat some numbers. If you could repeat the data about testing and the data about the positivity rate, that would be good. And also, I just want to make sure that of the 7 people who have passed on, 6 of them were residents of the Madison facility. Is that right? Okay.
That is correct.
Okay. And beyond those things, the Calvary Baptist Church in Sanford sent out a statement today in which they said that there were several members of their church community who attended the reception in Millinocket. And I would like to know what the status is of the state's investigation into the Calvary Baptist Church outbreak, how many cases there have been there, and if the state has established yet that there is a firm link between Millinocket and the Calvary Baptist Church.
Okay, so Patrick, let's start with the numbers.
That was really several questions.
Yeah, that's all right. We'll start with the numbers first. So to recap on testing, the one-day positivity rate in Maine was 0.59% yesterday, based on 2,708 tests reported to Maine CDC. The 7-day positivity rate is 0.63%. And again, for context, the national average, 5%. The volume of testing remains at 358 per 100,000, the national average being about 226 per 100,000. You mentioned Maple Crest. You're correct. There have been a total of 6 cases there, all among residents. What's important about the 7 individuals that have passed away related to the Millinocket wedding outbreak is that none of those 7 individuals attended the wedding or the reception itself. These are all individuals who got COVID from somebody who was at the wedding or somebody who got it from somebody else at the wedding, just as evidence of how virulent the disease can be and how far-reaching the effects can be. None of these 7 individuals actually attended the nucleus event. With respect to Calvary Baptist Church, I have not seen the communication that you mentioned, Patrick, and so I can't comment on that directly. Maine CDC we remain aware of 10 cases associated with Calvary Baptist Church. We're continuing the investigation. The news that you mentioned, or the report that you mentioned about individuals who had directly attended the wedding would be news. That's not what our contact tracers had uncovered thus far. So we'll be interested in touching base with the church or taking a look at that communication and seeing how that impacts the course of our investigation.
Thank you very much.
Mm-hmm. I'm going to turn next to Lindsay Mills at News Center.
Hi, Dr. Shah. A couple of questions. Are the cases at RSU 9 and RSU 56 linked in any way epidemiologically to the Rumford Mill outbreak? And my second question, you said that the virus favors gatherings. So looking ahead to, gatherings like Rosh Hashanah this week, Halloween upcoming, what's the CDC's guidance to go about those?
Sure. So we'll start with your first question, Lindsay. At this time, we're not aware of a direct link between the 2 cases that have been noted there and anything at the ND paper mill. That is, of course, an area that our investigators are looking into. Right before this briefing, I checked in with our epidemiology team, and that was one of the questions that I asked and that they're looking into, of course. So at this time, I can't confirm that. Hopefully, we'll have better information and a better sense of that over the next coming day or two. As we go into the next wave of gatherings and seasons where it will be common for all of us to gather, whether it is the high holidays or as we even start planning for Halloween and even going into November or going into Thanksgiving. We've seen all too many times across the country and even within our own state that the virus can catch fire and propagate in settings like that where people are close together for a long period of time. Fortunately, to the extent there is anything fortunate, the same advice and tools that can be used when it comes to a Memorial Day backyard barbecue or a 4th of July fireworks gathering can be the same ones that keep people safe as we go into the fall and into the winter, which is to say, wearing face coverings and staying as far apart as possible, even at a gathering. I think I mentioned 2 weeks ago as we were getting ready for Labor Day, no one likes to be doing that at a gathering of your friends in a backyard. No one likes to be the person wearing a face covering, and no one likes to sit 10 feet apart or even 6 feet apart when you're there to hang out and catch up with your friends. But time and time after time, we've seen COVID-19 take hold in those settings. And to the point that I made with Patrick, it can not just take hold, but it can then spread into areas such as your workplace and indirectly affect others who weren't even at that backyard gathering yourselves. And in the case of this wedding that we've talked about, sadly lead to 7 individuals passing away. So although I think the way we should all go about ourselves in the fall is with the goal in mind of socializing, to try to make sure we're keeping those social connections alive, especially as it goes into colder months where it gets darker sooner, but do so in a manner that keeps us all safe. I'm going to turn next to Brian Sullivan.
A fact to follow after Lindsay had that nice headshot, but I'll do the best I can. Can you talk a little bit about the work that's being done with the possibility of adding states like Massachusetts or Rhode Island to the states that would be allowed to come to Maine without quarantining?
Sure, Brian. We take a look at the data on other states, both that we have exempted from getting a negative test or quarantining, as well as those states that we have not exempted. Right now, Massachusetts has made, in epidemiological terms, they've made some strides just in the past week or two. Before we can change any policy, though, we need not just to see some strides, we also need to see stability in those data. Kind of like I mentioned a moment ago, we don't base policy on one day of data, really even just a couple of days. We need to see that they have achieved a new steady state with COVID-19 and are able to remain at that state so that the data that we see are not fleeting. And so with respect to Massachusetts, I think that's the epidemiological question right now. Is the progress that they've made durable, or could it revert? Rhode Island, I think, is still in a slightly different place, particularly with the number of new cases that they've seen and have been experiencing on an adjusted basis for population just over the past 2 weeks. But Rhode Island still has a bit more of a ways to go, perhaps. But we take a look at the data pretty frequently. And as states make progress, we then ask our second question, which is that progress something that's going to stick, or could it revert?
How long would you need to see that be?
At least one incubation period of the virus, which is to say approximately 14 days. Now, there's not a magic number there. If there are sizable outbreaks, for example, that we are aware of, that might alter our perception because it could be a signal that there are more cases coming, given the outbreak that we already know about. So there are some qualitative factors, but generally speaking, it's difficult to get a sense of where things are in an outbreak without having at least one full incubation period of the disease you're looking at. For COVID-19, that's approximately 2 weeks. That tells you whether the change that you've seen is something that's a day-to-day variation versus an actual potential epidemiological change, given the dynamics of the virus and the people it's infecting. I'm going to turn next to Allison Ross.
Hi, Dr. Shah. Thank you so much for taking my question. So when talking about school designations and the colors, so are there specific guidelines for each designation when it comes to green, yellow, or red? Or is it more subjective? I mean, are we looking for specific scientific research here?
Sure. So, Allison, we take a holistic look at a number of epidemiological parameters as we are making determinations about school colors. Some of those parameters are things that I talk about during these meetings, such as the positivity rate on a county by county basis and the number of new cases on a county by county basis adjusted for population. So we look at the positivity rate and the rate of new cases adjusted for population. And we do so over the preceding 14 days and also over the last 28 days as well. Just kind of in keeping with Brian's question, we're not looking to see, what happened Monday morning. We want to take a much more broad-based view. We also take into account other elements of data, one of which are the data from individuals who are going to the doctor's office or to urgent care or to emergency rooms with symptoms that could be suggestive of COVID-19. That is an early warning sign as to whether there might be COVID-19 on its way into a county about to take hold. We also take a look at the number of outbreaks. So again, similar to what Brian and I were just talking about, if we know that there is an outbreak in a part of a county and an outbreak that is likely to generate more cases, we take that into account as we're thinking about not just the next coming days, but the next week to 2 weeks as well. We take all of those factors into account. There's not a mathematical formula that we plug all of these things into that spits out a color, because we also want to use the art of public health as well as the science. That art being a recognition that some outbreaks may disproportionately impact students and others may not. So an outbreak that may be occurring, say, at a YMCA, where kids might be expected to go after school, might be thought of as different from an outbreak in somewhere that may not affect kids. So there are hard scientific numbers that we look at, but we do so in a holistic fashion.
And just one follow-up question with that. So is there a reason that it kind of was held off for schools in York County and Millinocket, why they were still green for so long before actually going yellow with the outbreaks that were there?
So again, we take a look at the factors as they're evolving. For quite a period of time in Penobscot County, and to this day, the situation in and around Millinocket was largely delimited to the Millinocket area. It's not one that we saw any epidemiological signs of spreading beyond the Millinocket area into other parts of Penobscot County, let alone adjacent counties. Similarly with York County, when the situation in York County started to become significant in epidemiological terms, as you'll recall, we actually introduced a new reporting phase into our typical 2-week system in order to account for that. Usually we only update the school designations every 2 weeks, but because of concern that we had in York County, we actually introduced an additional reporting period on an off week because we wanted to make sure we were taking a frequent look at the data. That's why we ended up ultimately moving things to the yellow designation, because we saw those early warning signs and thus built in that extra reporting period. I'm going to turn now to Joe Lawler at the Press Herald.
Yes, hi. So in light of the Maine CDC's heightened concern over trends, and with the US CDC report from last week saying there's an increased chance of catching the virus in an indoor restaurant dining setting, do you think the state needs to take a look at the current policies heading into the winter? Outdoor dining is going to be a lot less likely in the next few months. And then I do have a follow-up question.
Sure, Joe. I've been thinking about that a lot myself. No changes as of right now, but you're right. As we go into the winter or the fall months, there's going to be increasing pressure on all sorts of hospitality-based industries to have more people indoors. We've known for a while, and we now have a better granular understanding per the CDC report that you noted of just how much higher the risk is from indoor activities like dining. At this stage, Joe, I think we have an opportunity on an individual and community level to get a hold of what's happening with COVID-19, that's got to be the first step. Rather than broad brush statewide policy, I think step number one, in terms of its impact on changing the course of the virus, step number one, the first place to start is at the individual level to see where we can improve use of mask wearing, where we can introduce more physical distancing. That's where our focus is right now, but we are keeping an eye on other such matters like indoor dining and other things, but no decisions made there.
Okay, my follow-up question is, do you have any advice regarding trick-or-treating? Do you think it should continue, or should it continue in an altered way?
Well, Joe, we're still about 6 weeks out. So it's difficult to predict with any certainty, or let alone accuracy, where we may be with COVID-19 next week, let alone 6 weeks from now. When it comes to Halloween and trick-or-treating, there's a certain potential allure of a holiday where everyone is already wearing a mask. So we go into that analysis and recognizing that folks will automatically be masked up. There's some benefit there, but it's difficult to know today what the COVID-19 picture may look like 6 weeks from now. That being said, the same principles that we would apply to any type of gathering will likely apply to COVID-19. That is to say, trying to introduce as much physical distance as possible in between groups of kids and adults who don't live together, for example, to reduce the risk of transmission. Making sure that folks aren't crowded up at certain points, say waiting at a household that's known to give out really good candy. Trying to make sure that folks aren't crowded up against the front door there. So I think right now, the approach that we should be thinking about with respect to Halloween, as well as other gatherings that are coming up, should be similar to, for example, how we thought about schools a couple of months ago, which is with the intention of going in, trying to have those activities happen, and coming up with guidance and some good principles to have them happen safely. Depending on what the epidemiological picture looks like, we may have to change that. It's impossible to predict, but we should go in thinking about not whether or not Halloween will happen or won't happen, but rather how we can work together now to lay the groundwork for it to happen safely in 6 weeks. I'm going to turn next to Patty White at Maine Public.
Thanks, Dr. Shah. I was wondering if you have any more information about how the virus spread at gatherings like the funeral reception, if there were issues with, crowd limits or distancing or masks.
Based on what we know right now, Patty, it appears that the funeral in particular that you referenced, the funeral had two components, an outdoor component as well as an indoor component. Though we never will know, because of the nature of an unseeable virus, exactly when it transmitted, there's better reason to think that the transmission event occurred indoors. The case investigators are working to get a good sense of to what extent mask wearing was commonplace at that event, as well as the reception that followed. Right now, we don't have a good sense of that. But given that there was an outdoor component as well as an indoor component, our hypothesis is that the transmission itself most likely occurred during the indoor component. That would square with much more of the epidemiological data that we've seen from so many other gatherings. But right now, that's still an open question that our team is really trying to piece together.
Okay, thanks. And I'm wondering if you've got an overall takeaway for the outbreaks that we've seen in the state so far. I mean, obviously, they've been in many different places in many different circumstances, from workplaces to social gatherings, and the approaches to safety protocols vary. But is there a common factor that ties all of the outbreaks together? I mean, for example, does it always come down to mask wearing or something like that?
Sure, Patty. I'm going to start my answer based on some national data and then try to localize it to the extent I can for Maine. One of the intriguing findings that has been out there and published in the literature, one of the things that intrigues me, I should say, are situations when we might have thought there would have been transmission and an outbreak, but when that didn't happen. To me, it's sort of analogous to the very famous Sherlock Holmes story about the dog that did not bark in the night. There are situations where we would have expected transmission and an outbreak to happen that really didn't. One of the first such publications came from, I believe, the state of Missouri, where officials there published analysis around 2 individuals who were hairstylists, both of whom had COVID-19, and transmitted it to none of their clients. And one of the findings, of course, was that both stylists had face coverings on during the time that they were infectious. Fast forward even more recently, there have been papers that have now been published around similar events where individuals might have predicted there to be high rates of transmission. One I want to put a spotlight on is one that came out of the state of Maine. Dr. Laura Blaisdell and her colleagues, a pediatrician here in Maine, and her colleagues are very active in camps, in overnight camps in Maine, and put into place a series of steps that many camps in Maine followed, and found that when those steps were adhered to, transmission of COVID-19 was exceedingly low. They too published their findings in the same CDC journal that we've been talking about. When you take all of those things into account and look for the commonalities, both in areas where there have been outbreaks in Maine and where there haven't been outbreaks in Maine and elsewhere, the one theme that runs through all of those is mask wear. Face coverings, both at a molecular level and now at a population level, have been well associated at reducing the likelihood of transmission of COVID-19. Does it eliminate the likelihood? No. There's no intervention in medical science that eliminates anything, but they greatly reduce the likelihood. And we now have examples of that from positive cases, that is to say, situations where transmission did not occur, and negative cases, cases where masking was not commonplace and transmission did occur. Just in the most recent history, we've talked about the York County Jail, where masking was not the norm before an outbreak happened. That same trend can be observed in other outbreaks in Maine as well, almost too numerous to count. To me, this is the reason why a moment ago, I want to urge everyone to wear a mask before that outbreak hits your community, not afterwards. We've seen anecdotally that mask wearing is great after a facility undergoes an outbreak, but we shouldn't wait until after the outbreak before mask wearing becomes the norm. It should be the norm today so we can prevent those outbreaks from happening. And Patty and we can get you the references for those articles, or you can scroll through and find them online. But if you need those references, I can get you all of those.
Okay, thanks.
I'm going to turn next to Evan Popp at the Maine Beacon.
Hi, Dr. Shah. Thank you. So I have 2 questions about guidelines for office buildings that I don't believe have been specifically addressed in the industry guidance checklist that was released in June. So first in that document, there is guidance for how many visitors or patrons an office building can have. But can you clarify what the recommendations would be for occupancy of office buildings by staff? Is there a recommended limit to the number of people per square building in an office building? Or does that fall under the governor's executive order that limits the number of people who can gather? And then just secondly, if there is some specific guidance that the Maine CDC can offer employers about how to handle the wearing of face coverings in offices with low cubicles. And so the current guidance that I've seen is that face coverings are required in office buildings, but not in personal offices. And so should employers be requiring employees who work at low cubicles to be wearing face coverings at their desk?
Sure, Evan. So let's start with the former question about the limits within office buildings. And it does vary greatly on the composition of the office space itself. A large open office where individuals are intermingling and where there is no physical separation among and between the various offices is one epidemiological picture. Another one is a situation where there's a long hallway with full walls and doors that close with enclosed ventilation. The way that we think about those situations is much different from an epidemiological perspective because of that physical separation. So there is not a one-size-fits-all rule with respect to office buildings. The guidance of thus is kind of multivariate and goes into some different twists and turns. And that's a virtue of the fact that there is not just one single type of office building. I think managers, owners of facilities and offices have to use good judgment about what their requirements should be and key those off of what the risk of COVID-19 should be. So in a setting where an individual could be in a cubicle with high walls and low likelihood of spreading the virus from person to person, it's possible that an individual employee may not or could be in the cubicle and not need to wear a mask all the time. But in a setting that you described with lower walls, it's possible that there's the risk of transmission, and thus a mask may have to be worn throughout the workday. Impossible to say, because you really would need to know what the dynamics are and what the structure and composition of the individual office is. In recent days, or weeks rather, there's been additional research that's been done around other ways to keep offices safe. And some of this really accords with where Maine CDC and other environmental health experts have been talking about with respect to buildings for years. Things like ensuring adequate airflow and ventilation, as well as making sure there's adequate filtration as well. Both of those things in tandem with one another, ventilation plus filtration, are both essential elements that we're just now starting to better characterize as it relates to lowering the risk of COVID-19.
And so if I can just sort of interpret what you're saying there. So there's nothing kind of specific that you can say about what kinds of offices might want to limit the number of staff or what kind of cubicles someone might want to wear a mask at. It just kind of depends on the situation.
It depends very much on the situation. There are some general principles. So no gathering should try to be over 50 people indoors, but how a gathering is thought of in an office building varies very much based on the structure of the space we're talking about, the degree of interaction between employees. So it is a very much case-specific situation. And I think the bottom line here is that employers should keep in mind the principles that the guidelines are trying to get at. It's really more than just having a number in place. It's about lowering the risk of COVID-19 transmission. And so I think if employers keep the purpose of the guidelines in mind as they are applying them, the resolution to some of these gray areas becomes somewhat easier to see.
Thank you, Dr. Shah.
I'm going to turn next to Amy Brown at WERU.
Thanks, Dr. Shah. The first question today is actually about one of our listeners who was tested at the Swab and Send site at Bass Park on Saturday after returning to a visit out of state, and was just told that the earliest they can expect to get their results is Wednesday evening. It was 4 days later. That's the earliest. Do you have any idea about whether there are backlogs going on now? This is a lot slower than what we've been told people could expect.
Yep. Amy, I'd have to check on that individual's results. We're not aware. There are no backlogs right now at the Maine CDC lab, both in terms of turning around samples as well as reporting them back out to the Swab and Sends. The Swab and Send sites themselves are responsible for reporting results back to the individuals who come to them. But we would need to have more information about exactly when and where when that individual went to the Swab and Send in order to track the results. Generally speaking, what we've seen is about a 48-hour turnaround time from Swab and Sends. I myself am aware of several colleagues and close friends of mine that have gone to Swab and Send sites across the state. In one instance, an individual who went on a Monday morning and had results back by Tuesday morning. So it does vary. I can't comment on a specific case, but we're not aware of systematic delays either at our laboratory or with the Swab and Send sites themselves.
Okay, great. And My other question is, there have been 15 cases in Washington County since just shy of a month, August 17th, with 2 of them being active that full time. So I'm assuming these are long haulers. I know you can't talk about individual cases, but can you say what's being done in terms of monitoring the so-called long haulers in the state? If we know how many there are and what's being done to try to support them?
Wait, Amy, how do you know that they're the same 2 cases?
Just watching how the numbers have stayed steady throughout the time.
I don't know that assumption is fair or accurate to make. Cases come in, they can simultaneously be declared to be recovered at the same time that a new case could come in. So it could be the case, Amy. I don't know exactly who the 2 cases in Washington County are, but I don't think we can immediately conclude that they have been the same 2 people for that entire period. It may be that would be a hasty conclusion.
There haven't been any new cases during that period.
What's that?
There have not been any new cases in that county during that period.
Understood. So the case numbers can change quite dramatically. I don't know that we can, again, quickly conclude that, but long haulers, nor can we quickly conclude that they are so-called long haulers. That term is not one that the US CDC has defined. Individuals can stay symptomatic for a long period. They could have another illness that coexists on top of influenza. They could have other signs and symptoms of, say, seasonal allergies. There's a lot that can be going on that they could have lost touch with Maine CDC and thus not be able to be released from isolation until they regain contact with Maine CDC. So there's a lot of other factors that go into that before we would determine that someone is a long hauler. So yeah, not trying to evade your question. It's just not one we can immediately conclude is the case. There are individuals scientifically that have been known to be symptomatic for a longer period of time nationwide that's been described. It seems to be a minority phenomenon, thankfully. How prevalent it actually is at a national level is not well known, nor is it well known what epidemiological or immunological factors go into someone maintaining their symptom levels for a long period of time. I know that that's an area of scientific research, but again, I don't think we can immediately conclude that either of those 2 cases in Washington County fits into that category.
But is the state continuing to monitor if people are going on past the 2-week period and not recovering? Do they continue to receive monitoring?
We monitor our case investigators. Monitor individuals until their symptoms have resolved.
Great, thank you.
I'm going to turn next to Charlie at the Bangor Daily News.
Hi, Dr. Shah. Thank you. And sorry, I think my phone was the culprit earlier when you were having some feedback issues. So my first question is about the, in general, with long-term care facilities throughout the course of the pandemic being the site of so many outbreaks, one of the strategies you've discussed and others have discussed is cohorting cases of COVID, like keeping the residents of those facilities in one unit and separating them from, those who are not thought to have the infection. And I guess I'm wondering, can you tell me what is sort of the latest guidance for those types of facilities, both if they have outbreaks and whether, or if they do not have outbreaks? What is the guidance on when facilities should be using some sort of cohorting strategy?
Sure, Charlie. It's pretty much what you noted just now. So the US CDC and Maine CDC recommends that any residential facility, be it long-term care, a group home, a homeless shelter, a shelter for people experiencing homeless, where they have an outbreak situation, they try to put physical space between individuals who are positive and those, really 3 types of sections. Those for individuals who have been confirmed to be positive, those who have been exposed but not yet positive, and those who have not been exposed at all. That is obviously very difficult to accomplish. We've been systematically and consistently impressed with the ways that facilities in Maine have been able to put that into practice, even recognizing how hard it is to do. But that's basically the guidance that we give to any type of facility when they are reaching an outbreak threshold.
Okay, and then related to that, I guess my question is how well, with this the secondary outbreak at Maple Crest, do you have any sense of how well that facility has been in cohorting both, cohorting residents, but also keeping staff who may have been infected kind of working in just, one cohorted unit versus going around to the rest of the facility?
Sure, Charlie. So we had a discussion with Maple Crest yesterday, and this has been a topic of conversation with them since we first opened the outbreak investigation. It continues to be. I would refer you to Maple Crest for more of the specifics about the physical setup, because I don't want to get it wrong. But what we talked about and what they relayed to us was that right now, where they are is that they've been able to move patients who have tested positive to a wing and put up a physical barrier, a full physical barrier, not just a screen or something, but a proper physical barrier between that part of the facility and the part of the facility where there have been folks who have tested positive. They've also been able to keep staff who have been exposed working with positive patients, and then similarly staff who have been negative working with other patients. Staffing has been a challenge at Maple Crest, as is implementing cohorting measures. We've seen that with numerous facilities. But Charlie, just to make sure I don't get the details wrong, I would refer you to Maple Crest for the specifics on how they've implemented that. I would also refer you to Maple Crest for their implementation of cohorting in the earlier days of their outbreak.
Okay. I would just, as a follow-up, I would just note I've spoken to a family member there of someone at Maple Crest, and they say they were told that staff are kind of freely moving between seeing COVID patients and not. But I guess, first of all, it sounds like you are referring questions about that probably to Maple Crest directly. And then also, can you just speak about what are the difficulties to doing that cohorting approach?
Mm-hmm. So as to the staffing, our recommendation in any cohorting situation from day one, our recommendation would be that staff who have been exposed work with patients who are positive, and staff who have not been exposed work with patients who are not positive or who have tested negative, and that there be a clean line of demarcation between those. Based on what we discussed with Maple Crest yesterday, they are able to abide that right now. Again, going back 2 or 3 weeks, I don't want to misspeak about when something was possible and when it wasn't. So for the historical look at when they were able to do X versus Y, that would be something they would be in a better position to handle or address. I just don't want to get it wrong. The challenge that you note comes from a couple of different places. The first is just having adequate physical space. That's challenge number one. Challenge number two is around the staffing. Even though the facility may be experiencing an outbreak, the minimum staffing levels that are required are not suspended. Residents still must have the requisite number of staff with them and around them at all times, whether there's an outbreak, whether there's not an outbreak. There are added challenges depending on the nature of the facility. So for example, at Cape Memory Care, which we contended with back in Cape Elizabeth, that was a memory care facility. Individuals there were suffering from varying degrees of memory loss and the attendant dementia. Having folks stay in a particular part of the facility becomes an added challenge when we're working with individuals who have memory issues and concerns about their recall. So there are a number of challenges that come up with cohorting, and they're all going down to this core infection control principle of keeping those who have been exposed separated from those who haven't been.
Okay, thank you.
I'm going to turn for the final question today to Brad Rogers at WGME. Brad, are you with us this afternoon? All right, we'll reach out to Brad to make sure he gets his question answered. Before we wrap up today, I wanted to thank everyone for taking some time out of their afternoon. Things right now in Maine are in a challenging situation. And we at the Maine CDC are concerned, and we're asking everybody right now to do their part. We've got a choice in front of us in terms of what the next days and weeks of COVID-19 look like. And even though the numbers today seem to be favorable, the low number of cases, we can't base our decisions just on one day's worth of data. The trends that we've seen over the last 2 weeks tell us that things are either getting worse or not getting better. So we're asking everybody to make sure that they can do their part. Even though there are positive signs on the horizon, low hospitalization rates, generally favorable levels of testing, there are still concerning signs. And what we don't want to have happen is that those current concerning signs take over the positive signs. And in doing so, eroding the gains that the state of Maine has made and worked so hard to get to this point over the past 7 or 8 months. So we've all got this window of opportunity in front of us. Let's make sure we do the right thing and seize it. Thank you all for your time this afternoon. As always, please be kind and take care of one another. We'll talk again on Thursday.